Zambia is a country racing against time to improve its status from being a lower middle-income nation to a prosperous middle-income nation by the year 2030. Various strategic plans have been put in place to reach this milestone. Vision 2030 and the 7th National Development Plan are two such plans. Vision 2030 is a long-term plan that expresses the aspirations of Zambians, which is to live in a strong and dynamic middle-income industrialized nation that provides opportunities for improving the well-being of all the people. One of the clusters in the shorter-term plan of the 7th National Development Plan is that the country will have a healthy society with low disease burden and a low mortality rate. This is really important as there is no wealth without health. A good, strong, healthy citizenry is a bedrock of our aspirations of being a prosperous middle-income nation. Medicines Transparency Alliance Zambia is eager to play its role by creating and providing empirical evidence that can be used in influencing the formulation and implementation of the right health policies. META brings together all stakeholders in the medicines market to improve access, availability, and affordability of medicines for the 1/3 of the world's population to whom access is currently denied.
Looking at specifically for the distribution of medicines, availability, affordability, and that this reaches all areas of Zambia.
Medicines Transparency started in Zambia in 2008 and it was being funded by UK Department of International Development. The program ended in 2015 August. In January 2016, the Dutch government took over the program and instead of looking at the issues of medicines generally, we're looking at the issues of sexual reproductive health.
The principle of META is that you have government, and the government, we are talking about Minister of Health, medical stores, ZAMRA, the Zambia Regulatory Authority. Then you're also talking of even the Minister of Commerce. Then we also talk of the private sector, the civil society. Like you have, our local network is most composed of some CSOs.
META, together with AMREF Health Africa and African Center for Global Health and Social Transformation, ACHEST, are currently implementing the Health Systems Advocacy Partnership in Zambia. The HSA aspiration is to contribute to stronger health systems so people in sub-Saharan Africa gain better access to sexual and reproductive health services. The partnership focuses on strengthening human resources for health and access to essential sexual and reproductive health commodities, while advocating for good governance and equitable health financing.
And what we've done is that we're working on different building blocks. But as a partnership, we know that at the end of the day, health systems must be built, towing certain lines. And so we work in partnership with the Ministry of Health. Our role mainly is advocacy and decent, space. That is where we operate from. What we do is that we provide, policy advice to government. And our basis for policy advice to government is on empirical information. That is as a result of research.
META conducted a research in 2017 to measure pricing, availability, and accessibility of sexual reproductive health commodities in Zambia.
So our methodology was that we are visiting government hospitals or government health facilities, mission, private, and retail pharmacies, both in urban and also in rural areas, so that we have got a clear picture. This arised from the government commitment with the Family Planning Summit, which was happening in 2017, on increasing domestic financing for these commodities, improving the forecasting and financing of contraceptive services, and also increasing the method mix and strengthening tax shifting to community-based volunteers so that we can enhance availability of family planning services.
The 2017 study generated evidence and recommendations that would help in making sexual reproductive health commodities more accessible, affordable, and available. In February 2018, the HSA engaged 2 parliamentary committees. These were the Parliamentary Accounts Committee and the Committee on Health.
The world is facing a contraceptive funding crisis, and there is a global shortage of certain methods and commodities. If current trends continue, it's estimated that by 2020, there will be an annual global shortage of $233 million needed to pay for contraceptive supplies in public funding if public funding does not increase. We therefore call for broad actions at the national, provincial, district, and constituency levels to put in place sustainable plans and evidence-based policies that are informed by research in order to prioritize funding for contraceptives and strengthening systems that ensure contraceptive security.
We need to create an environment in Zambia where when somebody comes from the diaspora, they are welcomed in Zambia. That is the biggest problem.
I think job satisfaction, other than the greener pasture of a salary, it's also the work environment. If you're going to be working as a health professional and you're committed to deliver to your patient, to your client, and you are subjected to a work environment where you aren't able to deliver effectively, do you think that you're going to have that job satisfaction to stick around? So when there are no drugs in the hospitals, when there are no facilities in those hospitals, those facilities, you are not likely to retain.
If you go to Botswana, the government had a lot of incentives. You arrive with a brand new car, Naledi Motors, Toyota, all these. Yeah, no, very subsidized loan by government. Wow, here no Zambian doctor then could get even a Japanese car. So already the government there was creating incentives. So it's a matter of these are policy issues where government should create incentives.
Improving access to high-quality health workers and sexual and reproductive health commodities is challenging. It requires a vibrant and influential civil society and network of health leaders in healthcare facilities and communities to initiate discussion and reform.
They reported non-availability of the emergency contraceptive. For the commercial ones, they had, but it was also going faster than any other.
So you find that much as they come, because people understand the importance of this, they are ordered, but they'll give people like maybe community health workers, and you know where these community health workers stay, sometimes it's not safe, the way they store them, and not all the people will know those community health workers because others will be coming from different parts of the areas. So it's quite a challenge that we don't have enough.
Together, these individuals and organizations have the potential to act as watchdogs, to hold the private and public sectors to account, and to advocate for stronger health systems in an effort to shape health policy and represent the voices of fellow citizens who are unable to realize their right to health.
It's very refreshing to note that we have I want to call you in context that you are a watchdog that is obviously going to help make sure that our people get that benefit.
In April 2018, Medicines Transparency Alliance traveled to the Copperbelt province to visit 4 districts, namely Ndola, Kitwe, Mufulira, and Chililawombwe. The objective of this trip was 2-pronged: to present the 2017 Sexual Reproductive Health Commodities Policy Brief to civic leaders, including mayors, constituency offices, and district commissioners. The second objective was to introduce the local meta networks to the civic leaders and district health management structures.
In 2015, we started setting up these local groups, and we have 20 of them. 4 here on the Copperbelt, 4 in Northwestern, 4 in Central, 4 in Lusaka province, and 4 in Southern. So we've come to visit our 4 groups, which are in Dola, Kitwe here,
Mufulira and Chilabo to sensitize about this document that
we're looking at family planning, pills and all those devices. We've also looked at medicines which are helpful for maternal health. The mother who is pregnant, they go for delivery, and after delivery, even the child, when the child is born, the common diseases are diarrhea and the pneumonias. So where those medicines are available. And also the equipment which are very cardinal for a woman who's delivering, some procedures which are cardinal when the woman is delivering, and even to nurse the baby. So those are the things that we are looking at.
One major finding of the survey was that the mean availability of the 53 sexual and reproductive health commodities that were captured in the 6 provinces of Copperbelt, Muchinga, Lusaka, Eastern, Central, and Southern was worryingly low.
Again, when we went into the field, we managed to capture 132 institutions, in terms of where we collected data from.
And out of all the facilities that we visited, we found that availability was a challenge in most of the facilities. We're at 34%.
At 34%, this statistic means that the majority of Zambians have no access to sexual and reproductive health commodities.
This is leading to our very high mortality rate, which we've indicated earlier in the preamble there, about almost 400 per 100,000 population. That is a very high proportion. Very, very high proportion.
Antenatal and postnatal commodities such as oxytocin, magnesium sulfate, and gentamicin were inconsistently available across the public, private, and mission facilities. Low availability was also recorded for important devices such as ultrasound scans, incubators, antiseptic and suction devices. These medicines and devices are crucial to ensure a healthy pregnancy and life for both the mother and the baby. When not available, this can lead to serious morbidity and mortality. This, most certainly, has been a contributing factor to the sad statistic of 396 maternal deaths per 100,000 live births in Zambia.
Our Zambian government, did make certain commitments, and some of these commitments included increasing domestic financing for sexual and reproductive health by 2020. Okay, and we said as government that we'll contribute at least 1.5 million per year towards the purchase and availability of sexual and reproductive health commodities. We also made a promise to improve the forecasting and financing of contraceptives, and this is what is leading into the national social health scheme we're talking about.
To counter and improve statistics of the number of women dying whilst giving birth, the following recommendations were made. Improve the supply chain.
The social accountability platforms must be strengthened at grassroots level. The government must work with our community, accountability platforms like our networks, so that they are a link also with the communities. In the village of not meeting, there are meetings and things like that. I think at some level the community must be involved. Yeah. So that tomorrow when there's a problem, they understand where the problem is coming from.
Efficiency and accurate delivery of SRH commodities. Move to a pool system of SRH commodity stock ordering.
What we're saying is that by medical stores, they should not just say, no, this medicine is going to Chirawa, to Kaposo. They compile what they need, commodity by commodity, quantity by quantity. Then you give them. You cannot determine what they need from there. That is why, if you give them for ailments that are not here in Chilawamba, it will stay there and expire.
We know what we want for our facilities, so that we do what we want is. Because we look at maybe what has been happening in the previous units which are common, where we need more medication. So we order Chilawamba just to receive from medical stores, they always receive.
Provide continued staff training and increase the number of trained staff.
There's so much strides that is being made to actualize a certain vision. You know, we who are blessed with a responsibility to ensure that we actualize that vision are not doing what we ought to do. I receive a number of complaints in my office regarding the attitude of, you know, health personnel. You know, so sometimes and most times it's not an issue of shortages of personnel, it's the attitude.
Yes, government is recruiting this staff, but still there's also staff attrition, movements, and also, so you find that you go to a facility outside, say no, there was this nurse who was trained, but later on was transferred to another facility. It means those services will no longer continue. For example, the ROOP, the one which you need the experienced person to insert, the JADE which they put here, which you need also experienced person to put. So if that person moves out, then that service won't be there. Also, you find that maybe somebody is just alone at a facility and you have overwhelmed work. So to that effect, we're also proposing of why can't we, like all of those who are taking oral, you can easily give a community health worker who lives within the community, who can be able to deliver that service and decongesting the health facility itself.
Provide client education and outreach.
In government,
Yes.
the thing for the people is just try to implement
Yes.
what is in this booklet.
True.
It's very beautiful.
True.
Can help our people, especially the rural setup. When we talk about clientele education,
Yes.
there is waste.
Yes.
The rural woman, especially in terms of family planning,
Yes.
they don't take it very seriously. There are some, but the percentage is low. No, I was able to talk to this lady who had a lot of children, and then she was complaining. She was even telling me that, so I told her, no, children are not to give because children are from God.
Where we're coming in strongly, that's why we've identified meta networks, so that they should be able to speak in those communities and tell them their rights and how they can go about those issues.
Fund and make SRH commodities affordable. Increase the role of the local pharmaceutical industry.
VAT and excise duty is levied on materials, raw materials and equipment for the pharma industry. But you don't pay the same tax when you are importing finished products. So it becomes easier to produce these medicines from outside and then just to bring them here to be sold and be dumped on our markets.
Because when you buy a fixed commodity, it will be expensive now to the customers.
Yes, yes.
But when you get commodity, then you manufacture.
Yes.
It will be less.
Yes, exactly.
It's good that if you can just make government can just give it to them, yes, let's give away VAT on these raw materials. It shall be somewhere.
The civic leaders unanimously welcomed Meta Zambia's innovative ideas and pledged to work with both the local Meta networks and the Meta Secretariat to achieve the recommendations stated in the policy brief.
The program in itself, I would say it's a very, very good program. If, as we have tabulated all of you, the two speakers, if we could put those in use, even all the information that you've collected, we put them to use, it will create a better Zambia in terms of health.
I think we're going to work together, yes, because health, it's important for everyone. We all need to be healthy to live. So, it's a very good cause, and I hope that we work together.
And the eventual, the consumer benefits, was the people who are monitoring the movement, the distribution, and the best thing ultimately is that the consumer gets the benefit of having the medicine given to them.
We move together.
That's very good.
I think you are free to come to the office so that we work as a team.
So to me, I believe this is something that we should support as a local community. Like any other citizen, we also need sensitization. So I will assure you that we will definitely make a support. I'm very, very sure that I will give even my number to the local organizing committee so that they can maybe get, when we are a bit free, discuss it further and even engage other departments so that we we see this success.
Government alone can't do everything. We can't know what is happening somewhere. But with such kind of organization coming on board, then we'll be told this is what is lacking there, this is what is supposed to be done. To me, this is the best way of doing things in the nation.
I stand ready, my office stands ready to work with your team, the local team, especially if they are quick in blowing the whistle whenever we have these lapses, because I can guarantee you I'm one of the quickest, officers in responding to reports of ill activities or lapses by our people, because I think that all of us who are employed by government have got a duty to, I think, give a service. If you had somebody report that my office is inaccessible, they would have been lying. I have, I think, the best open door policy in this country.
The World Health Organization Sustainable Development Goal number 3 has the aim of ensuring healthy lives and promoting well-being for all at all ages. By the year 2030, the goal is to ensure that there is a reduction in the global maternal mortality ratio to less than 70 per 100,000 live births. At 396 maternal deaths per 100,000 live births, Zambia has quite a task ahead of itself. But the government has already put various interventions in place in order to reach the WHO target. However, this cannot be achieved unless non-state actors, including the church, communities, non-government organizations, and individuals take up the challenge and play a role. Medicines Transparency Alliance, as part of the Health Systems Advocacy Strategy Partnership, is playing its role by creating evidence that is then presented to policymakers in order to influence the right policies that will in turn enable Zambians access to quality, affordable, and readily available sexual and reproductive health commodities, irrespective of tribe, color, sex, or religion. This is truly the Zambia we want. A Zambia that is healthy and wealthy.